Hello, good evening, everybody. Welcome back to Wednesday with Health Alliance Network. Thank you for your patience during our technical moment, but we are live and ready for a great presentation this evening. So we have Steve Sellers, CEO of Health Alliance Network, and Steve Utley, CFO of Health Alliance Network, to guide you through this presentation period with us. In case you are new to the program and new to our presentation, which I see there are a lot of new folks here, I just want to tell you a little bit about who we are in short. We are a healthcare company, health and wellness company, where we focus on care by one-on-one interactions with board-certified medical doctors to our members. We provide services 24/7, 365, and we offer medical services, pediatricians, general practitioners, dermatologists, as well as behavioral health therapists, including prescription drug discount programs. And you'll see that there are ways also to allow yourself to get some free medications as well through some of the new postings that we just did. Those were very well received. Again, thank you for coming on the call tonight, and very timely. I think this call and discussion is going to be, and especially those folks out there who have children. I have two children. I have a 6-year-old and a 7-year-old boy. So that means school is back in full swing. Yeah. And I spent actually, I know you were calling me this weekend, and I was knee deep in kids and homework. You know, the amount of homework that we got on day one was phenomenal. So we spent the weekend kind of going through homework and getting the kids ready for that. So not only did they come home with homework, a ton of new homework and new challenges, they also came home with very unexpectedly and a little bit sooner than expected colds. So both of them were sneezing and dripping and all the things that you get when the kids go back to school and get an opportunity to share all new germs that they were able to avoid all summer. So with that, I want to pose a question to Steve and say, Steve, have we seen any upticks in the telemedicine usage since school kind of started over the last couple weeks?
Well, I got our statistics back over the weekend for August, through August. Interesting enough, as you know, about 60% of our users are females or women, and about 40% are men. Men probably wouldn't use their healthcare no matter what. I guess the women are making them use it. But interesting enough, we also track the dependents, how much dependent use we see on our application, on our platform, and the dependent use over the month of August went up about 50%, which says 50% increase, which says basically what we've been saying: back to school, back to germs. Yeah. And we know that happens if you have a child or two children in school. It just goes around the circle: one to parent, and so forth and so on.
Yes, don't get too close to me.
I'm not. I have no children in school that I know of. I think they've all graduated and long gone from that venue. Tonight we have kind of a special treat that we'd like to share with you, and it's a full-on presentation of Health Alliance Network. We did something very interesting today. One of the things that we did was give a presentation. I don't want to say who it was, but to a very large city here in South Florida. We did a presentation to them, and I would say that we were 110% successful with that presentation. They're going to be coming on board Health Alliance Network. They're going to bring their city employees. That means their firemen, their policemen, their first responders, and several other city employees. We're very excited about that. We spent, they gave us a 30-minute window to do a presentation to them, and we were there for 2.5 hours. So I would say that was a very good presentation, very fruitful. I have to tell you, I really enjoyed it.
It was good. And, I'm glad that we brought chains to lock on the doors so they couldn't escape in those 2.5 hours.
That's right. We're going to go ahead and start the presentation tonight. Steve and I, you won't be able to see us, thank goodness. You're not going to be able to see us, but we're going to go ahead and start the presentation. We're going to give you tonight the presentation that we give to the city today here in South Florida, the exact same presentation. You'll see what they saw and what they based their decision to partner with Health Alliance Network. So let's get started. What you see there now is the first screen of Health Alliance Network, which is the Health Alliance Network Integrated Healthcare Solutions. This is our open screen. This is what gets everyone's attention. Integrated Healthcare Solutions. This was prepared August 2018, so it's very, very current. We have some very exciting information to share with everyone tonight that's part of this presentation. Some things that even our seasoned agents and members are probably not aware of, so let's get started. First of all, here's what's really, really important that we go over, and that is that we are Health Alliance Network, a leading provider of telemedicine services, the only telemedicine company that's partnered with ADP, the international payroll company. ADP has now partnered with Health Alliance Network. We are also the only telemedicine company approved on Amazon. Yes, you heard that right. We are approved on Amazon. We are also the only telemedicine company to offer a fundraiser program. We are partnered with the largest telemedicine platforms in the United States. That allows us to give you 24/7 coverage with less than 10-minute average waiting time to see a physician. Our video and mobile virtual care technologies are embedded into an EMR workflow, EMR being electronic medical record. Our software is built for data-driven virtual care, program evolution, and member management. We're going to talk about that a little bit later, about member management and how we engage our members and what we do to keep them engaged. Our services, by now you're aware, are provided in all 50 states and Puerto Rico, and we are developing strategic alliances daily.
And here we are, our vision, which is to bring better access to healthcare for everyone, which is exactly where we started when we came up with the concept of trying to provide healthcare for folks in rural areas of the United States. And the latest on telemedicine return on investment, for all you acronym folks out there, ROI. As an example, Cigna compared 20,000 patients who used telemedicine from 2014 to 2016 with 20,000 patients in similar demographics that did not use telemedicine. So the population showed that 17% lower total medical costs by folks who are on the telemedicine platform. 36% reduction in emergency room utilization.
That's huge. That is huge.
It's phenomenal. And you figure 36% doesn't really reflect how big that number is in dollars. Absolutely massive in dollars. 97% case closure rate. What does that mean? That means 90% of the time when somebody would call for service and get to speak with a doctor, that the case was closed at that moment. Everything was done. There was no follow-up necessary, no secondary appointments. So their case rate is very, very high, even that compared to what you would get from your normal general practitioner. And 45% higher utilization of generics. So in offering generics as an initial to our members are able to save quite a bit of money, still getting quality medications, but we're having an ability to not have to go to the name brand every time, which obviously the cost could be 10 times, 20 times more on average.
Considerably lower, and we're going to discuss that in a little bit later in the slide presentation. One of the things that was particularly interesting today was this part on the right side of your screen that says Alabama County awards a 1.5% raise. Morgan County, Alabama integrated telemedicine into their healthcare platform. Their general healthcare is Blue Cross and Blue Shield. They integrated telemedicine, and they got about a 40% of their employment base using it, which that 40%, they were able to give their entire employee base a 1.5% raise. The city that we were with today found that particularly interesting because of the amount of money that was saved. The commissioner there, Greg Abercrombie, says that if they can get 75% of their employees on board, that they believe that they can give a 5% across the board raise to their employees. The interesting thing is we talk about return on investments in healthcare. Nevada's only commercial ACO saved over $800,000 in 12 months by introducing telemedicine to their customers, which is approximately 40,000 customers. Now, this next screen is going to bring it home and show you how real these numbers are to the average person.
You know, one thing I do want to note here as we're going through the presentation, as you notice, we're effectively reading the presentation. It was written in a way for you to read it and have a conversation with the customer that you're in front of, so that you can be well versed in the conversation that you're putting forth in your presentation. So it was written this way on purpose. So, for example, real-world savings for telemedicine users. Regents released new data showing consumers on average save over $100 per visit, including copay, when using telemedicine rather than in-person office urgent care or emergency room visits. Data are based on services provided in Idaho, Oregon, Utah, and Washington State and reflect cost savings associated with medical claims, mileage, and wait times in traffic and in the waiting room. You can't only add up what was the actual check you wrote when you were sitting there or as you were leaving the doctor's office. There's a lot of other costs associated with your time, your gas, leaving work, leaving school, the fact that you have to pay full price on prescriptions, everything else associated. And again, going back to that, we have 97% closure rate. It's a lot less closure rate. Probably a secondary follow-up may happen in your future as well to cover this $100 per visit.
Next, we're going to talk about the products and services that are provided by Health Alliance Network. I believe most of you are familiar with what we do. We are a telemedicine company, and the primary products and services that we offer are telemedicine. What we offer initially is unlimited healthcare that's convenient and easy to use. What we do is help consumers, health plans, health systems, and self-insured employers obtain better, faster, more convenient, and much more affordable healthcare than a doctor's office or even going to an ER or urgent care. What do we offer?
Uncomplicated healthcare with no copays, no deductibles, and no excuses or no excess utilization charges. Unlimited medical visits, unlimited dermatology visits, behavioral, mental health counseling, unlimited prescription benefit plan, 100% coverage for the entire family.
Again, I want to point out to everyone, if you notice the 3 phone screens representing what it would look like on your phone visiting with one of our physicians, there is 0 copay for dermatology, 0 copay for doctor's visits, and 0 copay for behavioral health and mental health counseling. Here's something that we offer. This is something that we are particularly proud of. It took us quite a bit of time to put this research paper together, but we offer a complete and up-to-date listing of nationwide pharmacies that offer free medications. We have found an entire list of pharmacies that you can get free medications from. It was interesting because during the presentation we made today, we quoted almost the exact same scenario. We called 12 local pharmacies here and asked about a cash pay on a generic version of a prescription. The price ranged from $0 to $223. So you could have, if you went to the right pharmacy, you could have paid nothing. If you went to the wrong pharmacy, you could have paid $223 for your prescription. Now that was with not using insurance. That's just walking up to the counter and handing them cash. $0 to $223. There are numbers of pharmacies, literally thousands of pharmacies nationwide that offer free antibiotics, free blood pressure meds, free diabetes medication, free prenatal vitamins, free cholesterol medications, free health and wellness magazines, and much, much more. That service is 100% free to everyone that is a member of Health Alliance Network.
On the medical side, we can treat over 80 different conditions, and that list is growing daily. Visit with a U.S. board-certified medical doctor on your time, 2 p.m. or 2 a.m., 7 days a week from anywhere. And then we list out a handful, and not all inclusive, a list of common conditions that we treat. This list grows daily as more and more advances are made.
Behavioral health counseling, this is becoming more and more popular as we're becoming acutely aware of the stress that people are dealing with on a day-to-day basis throughout America. In fact, we now recognize that 10% of our utilization is for behavior or mental health counseling. Our therapists and psychiatrists are available by appointment from the comfort and convenience of your home. Now, here's what's important about this. We recently read some studies done by Boston Medical and Harvard Medical School, and what they told us was this. Their research indicates that a telemedicine visit for behavior health is 80% more effective than a face-to-face visit. So you have to ask yourself, why is that so? Why would it be more effective to talk to a counselor on the phone or by a video chat than it would be face-to-face? The answer is this: people are more comfortable in their own home, their own environment. They feel safer. They're more likely to open up and talk about their real problems. Plus, they can do it in the convenient convenience of their home and their own schedule. Very, very important. When you want to talk to somebody, you're having an issue, you're having a catastrophic event in your life, you lost your job, your car got repossessed, something changed, you had a life event that has affected you emotionally. You want to talk to somebody right now. You don't want to wait 2 weeks for an appointment and drive to a therapist's office and sit down in front of somebody.
And a very important note on that too, as we discussed today, is not only is your information private, but some people feel there might be a stigma associated with going for behavioral health services, especially walking into a doctor's office and sitting into a behavioral health specialist waiting room with a bunch of other people in there. So this creates complete privacy anywhere you are. Nobody ever has to know that you went for this moment of support from behavioral health therapy. We are seeing an uptick in the usage of this product, and we expect it to have a greater impact on the nation as a whole, given the fact that this is getting out there more and more, and there's a bigger demand for behavioral health services.
Yes, there is very much.
So we connect your members virtually with psychiatrists and licensed behavioral health providers to engage in ongoing therapeutic care to tackle their behavioral health concerns, and providers that are available. We have psychologists, psychiatrists, licensed professionals, behavioral health services, and diagnostic assessment, ongoing counseling, e-script prescribing, common issues focusing on depression and anxiety. And between depression, anxiety, marital problems, child behavior, I think everybody can ring true to one of those at some point in their life, or
Absolutely.
one point in a month.
Absolutely.
Features 24/7 online scheduling, robust provider selection, and secure messaging, and a 15-minute free consult. So it's a strong, strong program that we bundled into our overall service packaging.
Let me clarify the 15-minute free consult. You get 3 clinical hours of behavioral health per year for the family. So the first 15 minutes is a free consult to see they want to analyze to see if you really should go into a program or if you're just going through a moment in your life. So it's very important that we realize that.
And that's great that they do that pre-screening, because you don't necessarily get pre-screening when you're sitting in the doctor's therapist's waiting room, and then you take up time and you're sitting in their office. You're going on for the full charge and full time no matter what.
Exactly. You're going to write a check for your $250 visit and maybe didn't even need to visit at all. In our case, there's no charge for your behavioral health counseling. It's included in our unlimited telemedicine products. Virtual dermatology.
Yeah, so with virtual dermatology, visit with a board-certified dermatologist online on your time again for skin, hair, and nail treatment that is fast, secure, and good for you. I know I've used it on my children. I've taken pictures, sent it in very quickly on rashes. Do I get response back? We take care of acne, cold sores, dandruff. Again, very, very relevant to the fact that we're talking about school time, high schoolers.
Yes.
That is a rough time with skin conditioning. So it's good that we have services available to them in the privacy of their home, that they can have these conversations and appointments with dermatologists.
And it's also important to note that not only do dermatologists counsel with you, they also are physicians, and they can issue prescriptions to treat the conditions. And sometimes we're not clear about that, but if you talk to a dermatologist, sometimes you may need a simple prescription to treat acne or any of the other conditions that we cover. The consumer experience, this is kind of interesting. The platform averages about 2,000 visits per day. It's solid as a rock. 97% clinical resolution. We're just going to reiterate what Steve said earlier, that 97% of the calls made to our telemedicine platform result in a final resolution. In other words, no further follow-ups needed from that physician or an insurance bill or medical doctor visit in office. 64% of our visits result in a prescription. That's strong. That means that they are getting a diagnosis based on the symptoms that they're presenting, and they're getting a prescription sent to their local pharmacy. Our most popular prescription medication is an antibiotic, and a few screens away from now, you're going to see where you can get or how to get the free prescription information from Health Alliance Network. Another interesting statistic is that we review over 10% of our medical charts every month by the clinical staff. We also have an NPS score of 82. NPS basically means how likely are you to recommend this service to someone without them asking, which is really interesting. Because if you get a good service experience somewhere, you go to a new restaurant, you want to tell somebody about it without them asking you, where's a new restaurant? And NPS score is relevant because no one asked you, you just recommended it. We scored 82 out of 100. That's a very strong score.
Second opinions. Now, I'm going to take a guess that many of you on this call did not realize that our service also includes the ability for you to get a second opinion. So you can take advantage of our world-class physicians. They will provide an expert second opinion on your current diagnosis and treatment plan. So for example, if you had an X-ray, an MRI, you can upload this information to your EMR, electronic medical records, and then schedule an appointment with a specialist who will review your information and let you know their thoughts on what it is that they're seeing and give you a really solid, qualified second opinion, again, without having to get another appointment somewhere else and paying to go see another doctor and go through all the same steps all over again. You have access to top quality physicians from the world's leading physicians, means more accurate diagnosis, highest quality care. Our network includes leading US hospitals and world-class centers of excellence, and fast answers. Get results in days instead of weeks or months and get started on the right treatment path faster.
I can tell you there's many times in my life I would have liked to have got a second opinion when I got a diagnosis from a physician. And most of the time you just don't want to take the time or spend the money to get a second opinion. You believe what you get the first time. It's always good to get a second opinion. It's a great service offered by Health Alliance Network.
So our providers, they are state licensed, board certified, and credentialed physicians, average 15 years practicing experience, specialized training in communication and diagnosing patients over the phone and through online video. And it's very important, the specialized training and communication, because I will say that you probably, through our experience, have an even greater one-on-one experience communication with the doctor that you're on call with and the doctor you actually go to in your office, because they specialize in communication.
Absolutely.
Nation's largest networks of board certified physicians, behavioral therapists, psychologists, and dermatologists adhere to highest quality standards of NCQA and URAC guidelines.
Here's something that we are particularly proud of, and we hear about this a lot. What happens after the appointment? I've made an appointment, I've spoken with a physician. What happens next? Well, when the physician discharges the patient, they send discharge instructions to the patient via the patient portal and secure email. Recently, we had one of our members tell a story to us where she called in for a diagnosis. She presented her symptoms to the physician. The physician diagnosed her with an upper respiratory infection and sent a prescription to the local pharmacy. About 15 minutes later, she got a message back from the physician. He said, upon reviewing your records closer, I feel that it would be prudent for me to also give you an additional prescription for an inhaler. She said that has never happened in her life, that a physician actually followed up with her and gave her another prescription on top of what they'd already issued in order to make sure that she had the best care possible. Now, e-prescriptions are interesting. Once you talk to a physician and they want to or need to prescribe you a medication, they can either e-prescribe, which is electronic prescription, to a local pharmacy, or call in prescriptions directly to the pharmacy of your choice. The update for your EHR, sometimes you hear EHR, sometimes you hear EMR. They are relatively the same thing: electronic health record, electronic medical record. It is automatically updated with the patient's personal health record by the attending physician. Notify the PCP. This is a great feature. If you list your PCP in your profile, the attending physician will ask you if you would like them to send the outcome of this engagement to your PCP. The PCP is your primary care physician. The attending physician will ask you. They will not automatically send the notes to the PCP because you may not want your doctor to know about that. They will send the consultational history and the SOAP note directly to your PCP if directed by you.
Now, this is interesting. This is an example of a demonstration of a doctor, a patient, and then another specialist being brought onto the same video chat to do a second opinion or have a consultation that expanded more than beyond the needs of the initial general practitioner. So you have the ability to conference in other doctors that are part of the program as well. Very, very powerful tool.
I want to mention that we're getting a lot of questions online tonight, and we will answer those at the end of this presentation, which is just a few more minutes. So be patient. We're going to answer the questions live and on air at the end of this presentation. Let's talk a little bit about marketing engagement. This is very, very important. Another point that we find is where the telemedicine products themselves lack when they're embedded into a health insurance policy. First of all,
so first, digital health adoption approaches mainstream society acceptance. So what does that mean? It means that as time is moving on rapidly, it's becoming more of a well-accepted thought that telemedicine and healthcare can be provided by your smartphones, which of today, 77% of Americans own a smartphone. 67% of Americans have or are open to using mobile health apps to manage their health. 96% of large employers will make telemedicine services available by 2019. Employers and health plans prioritize boosting consumer awareness, one of the final barriers to adoption of telemedicine. And in Medicare Advantage, this is tremendous. Medicare Advantage plans will be able to include telemedicine as a basic benefit by 2020.
Now, what does that mean? Exactly what that means is that people that are particularly in rural areas and don't have access to doctors, now Medicare has realized that those people are an underserved population, and now they will have immediate access to doctors in their rural environments. This is very important. Our Health Alliance Network engagement. Health Alliance Network engagement initiative is a multi-channel platform. What does this mean? We want to make sure that we are in touch with our members. We want to make sure that everyone who is a member of Health Alliance Network is aware and is using our healthcare services. We are very different than an insurance company. An insurance company is not going to call you and ask you to have a car accident so you can make an insurance claim. It's just not going to happen.
I love that example.
It's a perfect example. The insurance companies sell you insurance in hopes that you will not use it. We put you into our membership program for telemedicine in hopes that you do use it. And we continue to engage with our members on a weekly, a daily, a monthly basis. Our most recent one that we just talked about was back to school, back to germs promotion that we did. We're going to talk about that in just a few minutes. We have multiple touch points per month per member. We reach out and say, use your service. I promise you, your health insurance company, your auto insurance company, your home insurance company is not asking you to use your insurance. We're asking you to use it. We are not government funded. We are privately owned. We do not take any government money to support our services. Therefore, we encourage you to use our services.
And then we have the engagement playbook. The engagement playbook is a set of marketing strategies and best practices designed to promote awareness and increase utilization. On the screen, you'll see 3 examples of promotions that we've done recently. We're working with a pharmacy here in Plantation, Florida, private pharmacy, where they were doing a promotion and we helped them put together materials and packaging, as well as our back to school, back to germs, which I love that. That went out as well with back to school this past week. And don't let a bad cold ruin a good day.
That's a great video that we produced.
I know these all help create awareness, multimedia style awareness. It's not one way. It's not a straight text email. It's not just videos. It's not just audio or audios. It's not just graphics. It's a combination of everything to keep the user engaged with what it is that we're doing. They get different types of media each time. We update quarterly. The playbooks combine everything needed for a successful marketing campaign, including emails, print collateral, and digital assets, all customizable and available through Health Alliance Network, plus an effective communication calendar with the recommended actions and touch points to maximize campaign effectiveness.
Now, what that relates to is when we're talking to large entities, large groups, 3 or more would be considered a large group, we want to direct them to let them know how to engage their employees at different times of the year and remind them that they have telemedicine, that they don't need to use their insurance every time that they have a cold or a flu or any of those 80 other conditions that we treat.
This is a condition. Let's talk about conditioning. This is a reconditioning the way people think. Little by little, it breaks into the fabric of the country. So as we become more aware, as we become more engaged, as we become more used to taking advantage of our technology to access healthcare, this is going to be more and more prevalent. But we are in that early stage, as we were, before Google and all these big search engines came out, all these big technologies in the 90s came out, where we heard the names, but we didn't know what it was or how it even applied to us. We're in that moment with telemedicine, except our adaptation process now is a lot quicker. We're not 5 years or 10 years out from adoption. It happens in half a year cycles to where full adoption occurs. And we are in the middle of that cycle right now.
We are very much. One of the things we talked about today is telemedicine is typically embedded with health insurance coverage that large employer groups have. And this is an interesting statistics that we're showing you on the screen now. If the telemedicine is embedded with their health insurance, 56% of the employees don't know they have it. 25% of it think they do not have it, and 19% say they do have telemedicine. And what does that mean? That means that almost 80% of your employees are not aware that they have telemedicine. And we found that to be very typical. With the presentation we did today with the city, they said that they have telemedicine embedded in their healthcare plan, and they've had it for about 1.5 years, and they almost have zero utilization. Well, what that means, of course, is that nobody knows that they have telemedicine.
Which is, as we're looking at our overall program of marketing and engagement, especially agents out there who have seen the new back office and all the facilities available to them, that's going to be your key to success. This is what everybody is looking for. I get the technology, I like the service, but how do I get the word out? How do I engage my employees? How do I engage my people to use the service? Well, everything we have in the back office in our methodologies for marketing and engagement are the key to success with this program. So lower copay equals higher utilization. So you'll see on this chart, if your copay, let's look all the way to the right of the chart. If you have a $40 copay, you're getting about 5% utilization of your program, healthcare. As the copay drops, you start seeing an increase in the utilization all the way to zero, where you're seeing 20% utilization. This is a 4-to-1. This is 4 times the amount of utilization that you're going to get with telemedicine than your traditional healthcare. And why is that also important? That means 4 times the amount of people who are sick may not spread that around. 4 times the amount of people who are sick might get to a point of being cured of whatever it is they have before they have to end up in emergency. So it's not just a number. We're affecting lives here. We're making a real difference in not just people's pocketbooks, but their ability to function and stay at work and manage their kids in their life without having to be off and down in bed with them. So we're doing pre-care with telemedicine because it's available 24/7 at your fingertips.
It's interesting to note that from a zero copay to just a $10 copay, there's a 100% difference in utilization. That's an amazing number. Now, you would think you would use your telemedicine if you had just a $10 copay, but that number actually doubles when it goes to zero. That 4-to-1 utilization is 400% increase in the use of telemedicine when there is a $0 copay compared to a $40 copay. One of the things that we talked about today in the presentation, which they had an aha moment. We find people they will go to work when there's a large employment group, and this is a whole top floor. Actually, it's whole 9 floors of a building in the city. They occupy 9 floors of the building. There's a lot of sickness in that building at any given time. That people are more likely to get a diagnosis and treat their symptoms if they have telemedicine than they don't, because they have the everyday stresses of life. They have kids. They have commute time. In fact, one of the managers that we talked to today commutes 78 miles each way every single day to their job. That's an amazing amount of commute. So you can imagine the stress on top of that. So if you got the sniffles, you're not feeling well, you don't have time to take off work and go see a doctor, make an appointment. So you're going to infect, within that 3-day period that you're feeling bad and you get a cold, you're going to potentially infect the entire office. Telemedicine can help alleviate some of those stresses at the workplace.
In our professional services mission, our goal is to provide unrivaled implementation and client support through professional project management and strategic consultation before, during, and after the implementation. And our ultimate goal is to exceed expectations, resulting in continuous growth and long-lasting partnerships.
Again, we're talking about implementing our program with employer groups, but all of these statements that we're making equally apply to the single user that comes online and buys our product on our website. We have an unrivaled implementation program that is, bar none, far and ahead of everyone that we've seen.
So the adoption of telemedicine, of all 50 states in Puerto Rico have adopted telemedicine. And in only 2 states, Idaho and Arkansas, that your initial services are limited to video. So the doctor has to see you first to make sure you are a human calling.
See you on a video, not face-to-face.
See you on a video. But the adoption is there. The expansion of the services into Medicare, into the extending number of conditions that are supported through telemedicine are there and growing. And there's more services coming down the pipe as well that are going to be available for telesupport and remote care.
We have some pretty interesting things going on. We follow the state legislation pretty close. Our compliance department reviews what's going on in the United States as well as the world with telemedicine and the adoption of telemedicine. We are seeing a wave of acceptance right now. Again, let me remind you, we have a lot of questions coming through tonight. Feel free to say hello in the chat box. We have a lot of people online that we're the only ones that can see them unless you say hello in the chat box. We'd love to give you a shout out. What we want to talk about, are you ready to help us bridge the gap in healthcare? Let's bridge America's largest gap in care together. It just makes sense. Now we're going to open up the floor for questions, answers, and some discussion. We'll have to do that via the text box because we don't have a two-way audio one. So we're going to do that via the text box. I'm going to put up beside here, I'm going to put myself, our CEO, Steve Sellers, and we'll start answering some questions. Let me move this over here. First of all, let me give a couple of shout outs. Kenny, how you doing, Kenny? Jose, Vicky, welcome back. And yes, you will have access to this presentation in your agent back office. The entire presentation will be available. AJ is asking us, can the dermatologist recommend something to take out or reduce wrinkles and puffiness below the eyes? The answer to that is yes. There are prescriptions available for the prescription medication, and there are over-the-counter medications available for that. As you can see, I have no puffiness. I have no, well, never mind. Sarah, how you doing? Welcome to the call tonight. Sam, welcome to the call. Kamal, we saw you earlier today. Welcome back. Robbie, welcome. James, welcome to the call. Let me show a couple of things here. Any more questions that you have? Go ahead and put them in the little chat box there at the bottom. Give us the shout out. We see a lot of new people on the call tonight. There are a lot of people that we've not seen. That means the good news is getting out about Health Alliance Network, about our telemedicine programs. Remember, we are an unlimited telemedicine company that includes medical, dermatology, behavioral health, mental health counseling. Our free prescription service, now we have that list where we will provide you with a list of all the pharmacies throughout the United States. Literally, there's thousands of them that offer free prescriptions. It's in alphabetical order, so it's really easy to find for people here in Florida. You'll look at Publix or Walgreens. I guess Walgreens everywhere in the United States. I think it's called Giant King. I believe they're up in the northeastern part of the United States. They have an extensive list of free medications. It surprises me, actually.
You know, I have to say that article that we put out about prescriptions and free prescriptions and where to get them, it was a bit of an aha moment for quite a few people because we had a flood of people sign up for the prescription program, prescription benefits plan, based on that article that went out the door. So I think the message is getting out, the fact that healthcare is not what it seems to be. There's a bit of a cloak in front of it. And as we're peeling this away piece by piece, we're bringing all these benefits to the forefront. The investigation that we did, the research that we did into bringing that, although it seemed like a simple article that we put together and a list of places where they're offering free medications. This is not something people want you to generally know. Definitely the insurance companies and the drug manufacturers don't want you to know that there's a lot of places to get things for free. There absolutely are, and we're going to keep updating that list.
Steve, the question screams to be asked. How do I get my hands on this list that you're talking about?
Well, you have to sign up for the benefits program. If you go into the website, on the very bottom in the footer, you're going to see, or unless you have the email, you probably have the link already, but in the bottom footer of the website, you can click on prescription benefits plan, and that'll bring you right to the plan paid, and you can select it at $0 charge. You have this plan, get the information, get the emails, get the write-ups, and we'll be keeping you up to date on that. But yeah, if you have people you know, people you love that you want, even if they're not a part of that Health Alliance Network telemedicine program, get them on this benefits program to give them some benefits along the way. Everybody deserves to have access to this program. And plus, for yourself as an agent, for somebody who's marketing and doing campaigning and engagement, what a wonderful thing to share with people. Here's a way for you to get free medications for you, your family, your children.
And just everyone in your life.
Everyone, absolutely everyone.
Absolutely amazes me the study that we did where that's one medication for blood pressure went from $0 to $223 if you paid cash for the product without using insurance, $0 or $223. One of our agents was here by the studio last night. As you notice, the studio is actually my home. He came by the house last night. We were going over some medications. We were testing some of our software application. We actually provide you with an application for your phone or your desktop that you can research medications on. You can put in your prescription. It will tell you, geographically locate you, and tell you where the best price from 0 to whatever number that you can get the prescription in your own marketplace. Again, we want to thank everyone that joined us on the call tonight. We had a little bit of a late start. We had some technical difficulties here in the studio. Thank everyone for their call. We have 1 second here. We have a few more questions that need to be answered. See if I can pull this up. Medication for ADHD will be through which program? That's probably going to be through the mental health, behavioral health program. They have a lot more leeway. Behavioral health counselors and psychologists have a lot more leeway in what they can prescribe through telemedicine than a regular medical doctor does. So good question. Thank you very much. Do we have any other questions that I did not answer? I think I've answered everyone's question tonight. If I haven't answered anyone's question, feel free to email us at admin@Health Alliance Network. Get with the person that invited you to the call tonight. The call tonight was very, very interesting, very informative. People invited other people to join us on this call. We appreciate that. Get with that person that invited you if you have any questions, or just simply email us at admin@Health Alliance Network. Steve, you want to close it out for us?
I want to thank everybody for coming tonight and listening to this presentation. It's an important presentation. There's a very clear way for you to present this product, this concept, this business to potential customers, both large and small. You have a pathway to do it with all of the marketing materials, with all the presentations in your back office to be able to show this to folks. This will be available to you within 24 hours. It'll be posted to the back office, and we'll always be expanding everything that you see there. And just real quick, I think we're up to, is it about 198 marketing imaging materials?
We do. We actually have about 250.
250.
Oh, 250.
It's been 2 hours.
Yeah, right. We have a pipeline full of marketing materials that we'll roll out. We're calling it drip marketing, and the reason we're drip marketing to because it's a little bit overwhelming. It's the old analogy is how do you eat an elephant one bite at a time? If we give you 500 marketing ideas at one time, you're probably going to be a bit overwhelmed and not know where to start, and you'll be paralyzed. So all of that information will be available in the back office of our affiliates, our referral partners, and our agents. Please check your back office often. We do updates nearly every day. And again, Steve and I appreciate you being with us tonight at the Health Alliance Network Facebook Live call. And again, go to our page, get with the person that invited you tonight, and ask us for additional information. Thank you very much. Have a great evening. We'll see you next Wednesday night. Be sure to tell everyone, 8 p.m. Eastern, right here live on Team Health Alliance.
Thank you. Appreciate your time. Good night.